Hi, this is Dr. Duresti with the Cranial Release Technique, back with another video. Yesterday's video, I got a lot of comments on, as a matter of fact, so thank you for that. If you recall, in yesterday's video, I mentioned that there were 3 questions that I wanted to answer from some students, some practitioners, or some practitioners that, both practitioners that have studied cranial release and some that are thinking about it. And the third question that I wanted to cover, but we sort of ran out of time yesterday, was the question came up about why would a child benefit from the cranial release technique? And could I explain that? Could I get into that a little bit? Could I dive a little deeper into that? So remember, here's a plastic skull, plastic fetal skull, and you've all have seen a baby, your own baby, your patients, your friends, your family, where they say, well, be careful because the baby has the soft spot up in the top of the head. That soft spot is a fontanelle, right? That's cartilage, which will then ossify and turn into bone. But yet, again, just like you can see in the fetal skull, those bones are separate and they will never fuse. So again, we have the child being born. Now, the birth process, a normal, let's call it normal, natural birth process, whatever that is today, the normal process is the baby's head will start to come through mom's birth canal. And as that happens, the baby's head is getting compressed. So we have this compression, 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 compression. The head exits. And now, because everything was under compression, after the head exits, the bones of the cranium decompress. And that really kickstarts, again, back to Dr. Sutherland's primary respiratory mechanism. So when you look at it with the Hoberman sphere, if you want to pretend that the Hoberman sphere is the baby's head, and here's the head coming through the birth canal, we have compression, 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 and then the head exits decompression, and that's what kickstarts the mechanism. Okay? That's normal, that's natural, that's supposed to happen. That's normal. Now, when you look at modern deliveries in 2023, wherever you are in the world, whether it's C-sections, vacuum extraction, episiotomies, just the pulling and twisting that takes place during the birth process, just as the head exits, the obstetrician, the pulling and the twisting that tend to happen, which chiropractors were always interested in the cervical spine of the baby, which I am very much interested in that and very concerned about that. Probably more so now, I'm concerned about the actual cranium and the distortion that takes place from the birth process, from either the actual birth process of what was done, and even if you had a beautiful birth process and everything just went normal and natural and easy, you had a midwife and everything went smooth, many times you'll still see distortion. And this brings us to a deeper level of distortion. That distortion probably happened in the womb of mommy. And you're probably saying, well, wait a minute. Whoa. How could that happen? Well, when you remember back to your anatomy, the uterus is a muscular organ. And remember, the baby is forming in mom's uterus. And now you have to take into consideration mom's cranium, mom's distortion of her cranium, leading to a structural distortion through her body. So now you could almost say that the baby was formed and developed inside of a warped environment, and many times you'll see distortion, one eye small, one eye low, ears rotated, cranium distorted, right after the birth process. And of course, if you understand what I've been saying throughout all these videos and through what we do with cranial release, then why would I wait now for the baby to come in when they're 15 with a problem, or 25, or 45, or 65, or 85? Why wouldn't I address the cranium right after delivery? Which, of course, that's what I would do. So again, we want to maximize the primary respiratory mechanism. At whatever age we could apply cranial release. The earlier the better, the younger the better. Before birth, even better. Let me explain what I mean by that. I'm not going to affect the baby's cranium directly while mommy is still pregnant, but I can address mommy's cranium. And by addressing mommy's cranium with the cranial release technique, that then improves function throughout mommy's body. And by doing that, we then, in theory, have a healthier baby, a easier delivery, a shorter labor time, a much less traumatic delivery, better for everyone. So I hope you understand the global effects of the cranial release technique and why everyone should have it from the time we're born until the time we leave this planet. But that also means in the womb through mommy's head by affecting mom. So if you came into me and you were a pregnant woman now, I would recommend we do the cranial release now for you, mom, and also for the health of your baby. Okay? And what I would explain to young couples that would normally come into me is I would explain, hey, dad, that doesn't let you off the hook because we want you to be in the best possible shape. We want mommy to be in the best possible shape. Then when conception happens, you have the best environment in mom's body. You have the best quality sperm from daddy. That gives us the best potential for a healthy, happy baby. And that's what this is all about. Taking care of people from birth until death, maximizing function by maximizing, going back to Dr. Sutherland's concept of the primary respiratory mechanism. And just to follow up on that question yesterday, which I dove pretty deep into the primary respiratory mechanism, remember the old-time cranial osteopaths, cranial chiropractors, cranial practitioners, for the most part, would address bone by bone by bone by bone, look at the bone, look at things segmentally. In the world of cranial release, we're looking at the cranium globally. That's why we're addressing that's why it takes me 1 minute to address a very specific area, do a very specific technique which opens the entire cranium from inside out. That's the concept. So we're not looking at the body or the cranium from a segmental standpoint, a temporal problem, an occipital problem, a sphenoid problem, a frontal problem, an ethmoid problem. No. We're looking at the cranium globally. This is a global approach. And that's what separates the cranial release technique from everyone else. I'm not saying it's better. I'm not saying it's worse. I'm saying it is what it is. Why look at everything segmental when we can do this one technique that opens the cranium globally using the patient's own intracranial forces? Again, just to cover from yesterday, I'm using the patient's own primary respiratory mechanism to open the cranium from inside out. It's a whole different concept than anything that's going on out there. So, I think that's all I wanted to say about that. Hopefully now you understand why babies, children, adolescents, teenagers, adults, pregnant ladies, men and women of all ages and all men and women of all ages, signs, whatever it happens to be, everyone improves. We improve function with cranial release technique. Okay? And we're also doing something to the cranium, to a dynamic system with a very specific technique using the patient's own intracranial forces to open the cranium from inside out. A very holistic approach to wellness in the world of cranial release. All the details, from finding a practitioner to learning how to do the work, is all on the website at cranialrelease.com. This is Dr. Duresti with the Cranial Release Technique saying adios, my friends, from a cool, cloudy South Florida today. I even got the sweatshirt on, so I guess I'm turning into a Floridian now. It's about 70 degrees and everybody's in their winter parkers, winter jackets here. So it is what it is. The body adapts and handles and does what it has to do. So wish you all the best. Happy holidays to everyone. Talk to you soon. Dr. Duresti, cranialrelease.com, saying adios, my friends. Talk to you soon. Goodbye.